Good morning and welcome to Newsfirst Prime Time Sunrise.
Today is the 25th of June 2014. A very good morning to you, and you're joining us live from the Newsfirst Centre in Colombo. I'm Katharina Chang. Let's take a look at your headlines. Attention focused on conducting another dengue eradication program. All cows to be vaccinated to curb the hoof and mouth disease. Gunmen fire on plane at Pakistan's Peshawar airport. And Sri Lanka creates history by winning a test series on English soil. Sri Lanka defeated England by 100 runs to claim victory in the second test of the series played at Leeds and thereby secure 1-0 series win. The Lankans clinched victory in a nail-biting encounter that went down to the penultimate ball of the fifth and final day of the match.
England was set a target of 350 runs on the final day of the second test against Sri Lanka with 5 wickets down. However, a patient 67-run partnership between Joe Root and Moeen Ali, which caused unease to the Sri Lankan bowlers, came to an end when Nuwan Pradeep made a breakthrough when he dismissed Root. Thamika Prasad sent Matt Pryor back to the dressing room for 10 runs and claimed a 5-wicket haul. Chris Jordan scored 62 runs while Stuart Broad did not bother the scorers.
Chris Jordan, if not him. That's the one they're asking for, and they've been given.
The partnership of 21 runs of 121 deliveries between Moeen Ali and James Anderson delayed hopes for the Sri Lankans for historic victory. Playing his second test, Moeen Ali scored his maiden century of 281 balls whilst remaining on the field for nearly 6 hours and 25 minutes. All hope was rested on the hands of Shaminda Iranga to ease the Sri Lankans through to victory, and hopes were sealed when James Anderson was caught in the 5th delivery.
Up in the air, could be caught, it's caught! Leave it! Your Lankans go wild!
Thereby, Sri Lanka defeated England by 100 runs to claim victory in the second test of series and win the second match series 1-0.
They got the final wicket. Sri Lankan team as the 3 lads.
Incidentally, this is the first time Sri Lanka has won a test series against England on English soil. Although Sri Lanka under the captaincy of Arjuna Ranatunga had won a test in 1998, the series only comprised of a single test. Angelo Matthews was adjudged the man of the match.
The Ministry of Health has decided to implement a dengue eradication program, taking into consideration the sudden spread of the virus. Director of the Epidemiology Unit of the Ministry, Dr. Pabba Paliyawardena, states that the program will be implemented on the 3rd, 4th and 5th of next month.
The dengue eradication program will be implemented in areas that have been deemed as high-risk zones for the disease, which are namely the Colombo, Gampaha and the Kalutara districts. Dr. Pabba Paliyawardena, the Director of the Epidemiology Unit of the Ministry of Health, notes that measures have been taken to implement the program in 16 medical officers of health divisions. She states that over 7,000 locations were inspected in the Western Province during the dengue eradication program held from the 20th to the 22nd of this month. The number of dengue patients reported in the island so far this year stands at 15,775. Meanwhile, the Chief Medical Officer of Health of the Dengue Municipal Council, Dr. Ruan Vijayamuni, says that the dengue virus intensifies when adults who suffer from fever consume various medicines without testing for the virus. The main reason for adult patients succumbing to the dengue disease is the delay in treatment. We have observed that when a child gets sick, the child is immediately taken to a hospital to receive treatment to combat dengue. However, when adults contract dengue, they tend to take self-medication for 3 to 5 days without taking the necessary treatment, and it is when he or she is in a critical condition that medical attention is requested. We request everyone, especially those who are residing in Colombo to consult a doctor if the individual has a fever that lasts for more than 3 days, especially during this time period.
The Department of Animal Production and Health has decided to vaccinate all cows in the island to contain the spread of the hoof and mouth disease. Director General of the department, Dr. Kumara De Silva, says the decision was reached after taking into consideration the spread of the disease from time to time.
The hoof and mouth disease has spread in a number of districts including Galle, Munaragala, Kurunagala, Kaluthara and Kandy. The Director General of Animal Production and Health states that vaccinations for cows in the affected districts have begun. He notes that 5 million vaccines have been imported for this purpose. Dr. Kumara De Silva states that the disease has been contained in most of the areas.
The Fast Unto Death campaign launched by the officials of the Family Health Services of the Peradeniya Hospital reaches its second day today. The official charges that nurses of the Peradeniya Hospital have obstructed officials from reporting to work. Chairman of the Government Midwifery Services Association, Devika Kodituwaku, stated that members of the association are currently engaging in a strike action in hospitals in a central province. The Fast Unto Death campaign has been launched because for the past 2 months, nurses from the Peradeniya Hospital have been obstructing the midwives from carrying out their duties. Furthermore, the director of the hospital has issued an internal circular that contains decisions that weren't fair to them. Midwives are requesting the director of the hospital and the Department of Health not to implement the policy decisions and to allow the midwives to carry out their duties without any hindrance.
ඔවුන්ගේ රාජකාරී කටයුතු වල යෙදෙමින් ඉඩ සලසන්න කියන කාරණයක්.
However, members of the Government Nursing Officers Association states that they have not been causing any disruptions to the work of officials attached to the Family Health Services. Director of the Peradeniya Teaching Hospital, Dr. Jabandu Herwat, says that numerous discussions have been taking place in order to resolve the matter. He pointed out that he was unable to fulfill every request that was tabled at these discussions. The Ministry of Health has taken measures to commence a program to create reconciliation amongst trade unions in the Ministry of Health.
Additional Secretary of the Ministry of Health, KAS Kiragala, states that separate and group meetings will be held for trade unions in the health sector. Through this, the ministry is to obtain comprehensive information on issues in the health service and the impact caused to these professionals from other services. The Additional Secretary states that discussions will be held on finding solutions to these problems without resorting to strike action. The Ministry of Health reiterates that trade union action arising from issues among the unions deprives the public of a quality health service.
Academic activity of the Arts Faculty of the University of Colombo, which was closed for a period of 94 days, will commence today. Dean of the faculty, Professor Atula Ranasinghe, says that academic activity for second and third year students will commence on the 1st of next month. University officials also notes that academic work in the education faculty will also commence concurrent to this. The University of Colombo was closed 3 months ago due to a protest commenced by students based on issues pertaining to the increase of boarding fees.
Newsfirst is the most trusted news website in Sri Lanka, using a multi-platform responsive layout for a richer user.
And on that note, we conclude this edition of Primetime Sunrise. It was a pleasure having you with us. For the Newsfirst team, I'm Katrina Chang. Have a lovely day ahead.
Hotline 0114 896 896. www.newsfirst.lk. Feedback at newsfirst.lk.